So, hi guys. I'm now 1 week post-op of periareolar surgery. So, I'm doing a quick update to show you the results, which are actually looking quite promising at the minute. There's a couple things to worry about, but nothing to worry majorly about. But I know a lot of you out there are excited to see what it all looks like and stuff like that, and if any of you FTMs out there are about to go through the same thing, then I'm kind of hoping this video is going to be really helpful to you, so you could have a look and hopefully look forward to your surgery, providing that you're as pleased with the results of my chest as I am. So yeah, I think I'll show you my chest now. So yeah, as you can see, this nipple's a lot darker than this one. The reason being, this nipple hasn't quite taken to me yet. There is quite a bit of pink in it, you can sort of see. But the nurse said it was like 90% black. I think that's crap. Personally, I can see a lot more pink in that. The reason I'm able to expose them now is because I'm just about to get in the shower. Yeah, so keeping my knees up, sorry. This one's taken quite well. I can't feel anything, but it seems to be responding when it's cold. It stands on end and shit like that without sounding too weird. The bruising, don't worry, that's not a third nipple or anything. But yeah, so I've got bruising here, this is the side they operated on twice. Just to clarify, because nobody I've watched anyway has actually clarified what I'm about to say. One thing that did freak me out just a little bit when the plasters were coming off is this star effect. So all the lines going down, and I got a little bit worried about it, and I was like, well, why is that like that? Is that supposed to be doing that? And they basically said it's totally normal. I should have thought about it logically before, but basically, obviously, if there's skin that used to cover something that size and now it's covering something that size, they've got to pleat it so it fits. Otherwise, if they cut it out, you just have lines going up your chest, whereas these aren't permanent and they'll eventually iron out. So all in all, I'm quite happy with my results. Next to no swelling whatsoever, as you can see. A lot of people I've seen have their surgery before where the swelling was quite bad. I have noticed that this nipple is actually lower than this one. I mean, the surgeon did say that symmetry wasn't a guarantee, but yeah, it's bothering me a minute at the minute, but I'm kind of hoping. I think it's because it's so dark at the minute, it just stands out like a sore thumb that it's a bit lower. But yeah, I'm hoping that when the colour goes, like the nurse reckons it's going to scab over, and then a couple of layers will fall off, as she worded it, or just come away, or whatever she said, which freaked me out quite a lot. But it's still quite squidgy, which is good, which means my body isn't rejecting it just yet. She said that if it gets hard, which it doesn't feel it, feels hard around the edges, but then so does that one, so yeah, she said if it gets hard, then that's it, basically dying. So fingers crossed, 1 week post-op, and all good. So I'm hoping that that's gonna just scab over, peel off, and just reveal itself to the world, by which point hopefully I'll be a lot better and movement will be a lot better. Although I did drive my car yesterday for the first time, and actually it wasn't that bad. The driving was okay. I returned to work yesterday, which a lot of people strongly advise against. But, you know, we're in the real world now, and some of us can't afford to take 6 weeks off and still pay the bills. So, yeah, basically returned to work, but I found that okay. It was a little bit hard, it was tiring. I got very tired very quickly, but I managed to go through the night fine. I'm a DJ, for those that don't know. So it was alright, it's nothing too strenuous, I wasn't lifting shit or, I don't know, sat at a checkout, I don't know, I didn't really move my arms very much at all. So yeah, all in all, I'm quite happy with the results. If anything, I'm over the moon. A lot of people have been saying that my smile is more genuine now. Weirdly enough, I mean, I thought I was happy before, but I think my true feelings from, within are really shining through now. So yeah. I just gotta hope that that this goes pink, really. Just pray to God. But yeah, like I was saying, the only side effects I'm getting, which I've not noticed anybody else report on, I did speak to a nurse about it, she said it was nothing to worry about. The side effects I'm getting from the binder, actually, and this whole section here, which you can see is actually pretty shiny, is really, I'm getting this burning feeling when I'm wearing my binder, which does ease as soon as I take it off, and the skin, although it's all numb, feels really tight. It's just it's hard to describe any other way. It just feels like it's being pulled, so that's not always great, but they said it's nothing to worry about, and that should go over time. I thought the binder was too small for me, because it is bloody tiny, but they reckon it's fine. They did a few checks on it, stretched it in every direction, and they think it's more than big enough, so whatever. But on updates where testosterone is concerned, because I've not actually covered that in quite a while, I noticed now I've started looking at my chest a lot more, which obviously I didn't do before. You can't see on camera, but I've got a lot of dark hair coming in around here, just on the one side, by here. I know, so I've got a cup over there, but that's it. But I've got more. But I have got an actual ladder starting to form by there. But which I thought was actually really hairy. You can barely see it on camera, and that's really bizarre. It's all around here, really fine hairs. But yeah. So yeah. I'm actually, like I said, really, really pleased with the results. A lot of my friends are saying it's looking good. After taking my top off to everyone I see, pretty much. I can't stop staring at myself. Sounds really big-headed, doesn't it? But if you've got your surgery coming up, you'll know what I mean. But yeah, I guess this is the I'm happy, everything's amazing video that everybody else does that I didn't do 5 days ago, or whatever it was. But yeah, I'm not gonna lie, the surgery was really hard. It was really hard going through it, and it's something I don't think you can ever prepare yourself for. I think you can do as much research as you want, you can speak to as many people as you want, but I think until you go through it, it's your own experience. It's probably going to be different from anybody else's. And yeah, you just can't prepare for any of it. It's just so, it's just hard. It's physically and mentally draining. And when I think about it, my surgery was in a private hospital, and I had nurses waiting on me hand and foot, and just to think, if I was in an NHS hospital where I wouldn't have had that kind of care, I can't think how hard that would have been. So credit to people that have been in NHS hospitals. I just can't even imagine what it must have been like to have been on a ward full of people or anything like that. I had my own room, ensuite bathroom. I didn't even leave it. As soon as I went in there on the Wednesday, I didn't leave it till the Friday. I was only in the hospital for the 2 nights. And yeah, so credit to you who go to the NHS hospitals, because I found it hard enough being in a private hospital. But yeah, but if there's any questions any of you have got, don't hesitate to either send me a message or comment on here. I'll be more than happy to ask. I've gotten quite a lot of inboxes already through my YouTube. Also, quite a few people have added me on Facebook and asked me stuff. I'm always more than happy to help. It doesn't matter what time of night or day it is. I'll answer anything you got. If I can't answer it, then there's probably someone I know or somewhere I know where you can find the answer. So give it a shot. You never know. But yeah, I just want to say, like I always do, thanks for all your support. I can never thank people enough, really. I think I'll just spend my life thanking people. But it really is amazing, you know. It's just incredible, like, the amount of support I get off people. And they don't realise how much of a difference they make to my life. And how strong they make me. I'm strong because of my friends and family and my girlfriend. So, yeah. It's everything's looking good, and I'm going to be updating now weekly, probably as time goes on, monthly, but for as long as I've got to wear this binder, I'll be updating weekly, so that's for the next 6 weeks at least. So yeah, like I said, I'll keep you posted. You've got any questions, ask me, even if you're not FTM, even if you're just curious in general, give me a shout, you know I'm always here. So yeah. Thanks again, guys, and I'll see you next week.